Come work a 12-hour night shift with a labor and delivery nurse. So I worked the night before, so I slept on and off for most of the day. And then when it was time to get up, I brushed my teeth, got ready for the shift, and then headed off to work. I changed into my scrubs and my work shoes. I wear the Danskos clogs. They are my absolute favorite. I wear the ones without the huge heel though. I was assigned to the operating room to be the scrub nurse for a C-section. So I made sure that the operating room was ready to go and had all the necessary equipment needed for a C-section. And then I headed off to scrub my hands. We use a chlorhexidine prep sponge, which helps to sterilize our hands and make them ready for a C-section. So I did that, and then we had a beautiful baby girl during the C-section. After I cleaned up the operating room, I went and did the baby's vital signs in the recovery room and also gave baby her vitamin K injection. I took a break and then did some stocking, and before I knew it, it was already 3:30 in the morning. This is a really hard time for me on night shift. It is when I find I am the most tired. Thankfully, someone came in labor so I could admit them, which kept me busy and awake for the rest of the shift. I knew things were going to move pretty quickly because this was not her first baby. So I got everything ready for her in the labor room and then charted her admission. We were having some trouble monitoring the baby's heart rate, which sometimes can happen, especially if they are not behaving well inside. So we inserted a fetal scalp electrode, which is a little electrode that sits underneath the baby's scalp, and this helps us to better monitor the baby while in labor. She also wanted an epidural, so I made sure to start her on some IV fluids, and then before we knew it, we had a beautiful baby boy, and my shift was over. I grabbed some new scrubs for my next shift and then clocked out on time at 7:40 a.m. and then headed off to bed for a few hours.